Hi, I'm Antoinette, and I am doing my NG tube validation video. I would start by walking into my patient's room, providing privacy.
Sorry.
And then performing hand hygiene. Then I would come over and introduce myself and identify my patient using 2 identifiers, confirming that his name and date of birth are the same as what's on his wristband. I would ask my patient if he had any pain or allergies. He doesn't have any, which is good. And then tell him that we are doing feeding through his NG tube and that we have a doctor's order. And now I'm going to bring the bed up to a working height. And we're going to put your head down flat so that we can do an abdominal assessment. Start by exposing the abdomen and just start by inspecting. There are no signs of distension, no wounds, no bruises, which is all good. Then I would auscultate in all 4 quadrants, listening for foul sounds. Bowel sounds are present. I heard 5 to 35 clicks in a minute. Then I would continue with percussion. So I'm listening for tympani. Sounds good. And then we would start with some light palpation. Checking for tenderness, any swollen organs, any masses, and then deeper palpation. And now we can cover them up. Still comfortable? Okay, good. And bring the head up. 45-degree angle for feeding, and my patient is comfortable, so we're good. I'm gonna put a chuck over Mr. Smith's chest here so we don't make a mess on your nice clean gown. And then this tube would usually have an attachment piece here, but we don't have one, so just gonna work with what we got. Now I'm going to aspirate. No, I would start by checking to make sure that an x-ray was done to check placement in the stomach and measure the tube from the tip of the nose to the end of the clear tubing, being sure not to tug, and then check the measurement with the previously recorded measurement for whoever did the feeding last, to make sure that it matches, to also confirm placement. And now I'm going to aspirate. Yeah, okay. So this would be closed, and I would uncap it and clamp it to make sure no air got in. And then put my syringe in, just aspirate a tiny bit so we can check the pH of the stomach. And now I would use a strip, put it in, and it turns orange, which means that it has a pH of 4, which is normal for stomach contents. In color is also yellowish green and liquid. So that's also a normal finding. And now I'm gonna move that out of the way so we can have only clean things in front of us. And then I would come back and get my tube, and I'm gonna aspirate for residual volume. By clamping the tube, uncovering, clamping, making sure no air got in, and pulling back until I feel resistance. So right around 60 mLs, cover it, release. Oh, when I did that, I wouldn't have had it clamped as I was aspirating it. That was silly. I would have let it go as I was aspirating the contents. And then put it into my cylinder here and measure how much residual there is. If there was more than 250 cc's or mLs, we would hold the feeding. So we only have 60, which is good, and then now I'm going to return the contents to the stomach. So let's start by taking the plunger out of my syringe, because we don't need it, and uncapping the tube, clamping, attaching, and then filling it up to the 60, and then releasing. The higher you go, the faster it will go in, and then the lower, the slower. And you would keep doing that until you put all of the residual volume back in. Then you do that, clamp, cover it, and so the residual volume is done, and we don't need this anymore. Now I'm going to throw my dirty gloves away and perform hand hygiene, and then put on a clean pair of gloves before I touch any of these things. So now it's time to start the feeding. We will start with flush of 15 to 30 mLs, and so I would check the expiration date on the sodium chloride bottle, normal saline, and make sure it's not expired. And then I would grab my tube, uncover it, clamp it, and attach my syringe. And then pour in 15 to 30 mLs, and then unclamp and let that run through. Once that was done, I would clamp it, undo it, recap, and let it rest for just a second while I come and look at my can of feed. So I would check the formula to make sure it matches the physician's orders, and then I would check the expiration date. This is not expired, that's good. I would make sure that I have enough to fulfill the ordered amount of tube feed, and then I would clean the top with an alcohol swab so that there are no germs. And then I would come back over, uncap, clamp, and attach my syringe again. And then pour in up to 60 mLs. Let it drain through. Once it got down to about 3/4 of the way, or 1/4 of the way full, I would clamp again, and then fill, and then let it drain. I would ask my patient to tell me if he or she were uncomfortable during this process. And I would keep repeating that until we got the entire amount in. Then I would go back and get some more normal saline and flush with another 15 to 30. So I would fill it with 15 to 30 mLs, let it drain through, Now the tube is clean, and I would clamp before I take this off because you don't want any air to get in. Take that off. Reattach the port. That's closed now, and that's done. So then I would clean up all of my supplies. Get rid of all of my used stuff. And take my gloves off. And then I would leave my patient's head up at 30 degrees for at least an hour so that I can come back and reassess to make sure that they are okay. I would cover them up, make sure they're comfortable, bring the bed down so that they are safe. Make sure he has a call bell, ask him if he needs anything else, and that's it.